Adria Gross is a nationally recognized medical insurance advocate, author, and founder of Medwise Insurance Advocacy. Having faced a 25-year struggle and life-altering experiences with a major affliction and undergoing transformative brain surgery, Adria came to something of an epiphany regarding how people are perceived by society and the impact medical procedures can have. Determined to help others navigate similar obstacles, she pursued a career in medical claims consulting and became a licensed insurance broker. Today, Adria leverages her personal experiences and professional expertise to advocate for individuals and families across the country, assisting them with denied claims, exorbitant medical bills, and coverage disputes. She's a co-author of Solved, Curing Your Medical Insurance Problems, and is frequently called upon by media outlets to share her insights on patient advocacy and healthcare reform. Adria took the brave decision to share her story with the world through Apparently Different, with the hope to inspire people to welcome and embrace relationships with individuals who experience challenging medical conditions, because everyone deserves respect. So just before we start, so obviously there's a big difference between US and UK healthcare systems. We'll sort of make clear what we're talking about as we go along. Adria's already been kind enough to give me quite a bit of her time talking about my family and what we've been going through. So I'm really looking forward to learning from Adria and to understanding more about her. So you're very welcome. I have to start really with asking a little bit about what life was like growing up for you, what your health challenges were, and how that impacted your future life direction.
So I was 11 and a half years old taking horseback riding lessons. And I did not know this, but an insect bit a horse carrying encephalitis, which is a type of sleeping sickness. The insect bit me, and I went into a coma. The teacher said, and one of my classmates walked me down the hall. I sat down in a chair, and that's when I went into the coma. So my dad came to pick me up, and he comes into the building, and he realized I could walk, but I couldn't talk. And then he said to himself, "Hey, I better take her to the hospital." So the coma lasted for about 10 hours. And I always tell people, when I woke up, I look straight ahead and I see a cross on the wall thinking I'm in heaven. But here I was in a Catholic hospital. And after a week in this small town where I came from, Port Jervis, New York, which is about 60 miles northwest of New York City, I then went to New York University Hospital in New York City. And it was scary, especially for my parents, because at first they thought that I had a brain tumor, but instead it was an inflammation of the brain. And I lived with epilepsy until I had a left temporal lobectomy, where they took out the damaged area of the brain. The seizures were uncontrollable. At one point, I was on 32 pills a day. I had been on 18 different medications over this almost 25-year period. But finally, I had the brain surgery, and the next day, it was very interesting. The next day after the surgery lasted for about 7 hours. What they do is they put neurons on the brain. They cut you open, and they put neurons on the brain. And if you can answer, they can cut. If you can't answer, they can't cut. But the following day, the woman who was working the electroencephalogram, the EEG, she came in and said, "I'm not supposed to tell you this, but they believe you're going to be seizure free." So it was pretty remarkable. And not only did I become seizure free, but after 6 years slowly coming off the medication, I don't take any more medicine, and I'm totally seizure free.
That's well. First of all, what a story in terms of horse riding, and then going from a horse riding lesson to where you are today. So when they discussed with you about, okay, we've got this operation that we hope will make your life better. I'm sure they didn't say cure you.
Right.
How was the decision making process around? Was it just that I'll try anything to stop these seizures?
Well, I'll tell you, it's in my book, and it's crazy. I was in a marriage where my ex-husband was cheating on me, and I knew he was having this relationship. It was very obvious. Uh, but one night, there were a couple of instances that happened. And one night when he was with me, I had two different grand malls. And what was happening is if he was not there to turn my head, I would have suffocated on vomit and died. So that's something that I'll always remember, and happy that he was there with me to help me. But that was one experience. And then there was another experience where I had a grand mal and I'm walking around in New York City on the Upper East Side in the 80s going to a doctor. I had a grand mal. I fell down near a tree that had like a little gate around it. The gates in New York City are usually like maybe a foot to 18 inches. And I fell down. I got up, and a lot of times after I had a grand mal, I couldn't speak. So there were people around me. I'm very embarrassed. They're standing around me, and I get up. And at that point, I was already starting to look into this surgery. So I finally find his office, but again, I can't speak. And I saw the doctor, and he understood that I couldn't speak. So it was like a baby, taking care of a baby, because a baby can't talk. So he starts feeling my body to try and find out what's going on. And as soon as he touched my ribs, I realized I had a broken rib from falling. And he told me that. And then before I left his office, I was able to get my speaking back. But after that, I thought, okay, I'm going to do the surgery. No choice anymore. I'm going to go forward.
So in the UK, I know the health service is very different than the US. So in the UK, we have what we call treatment that's free at the point of service. So if you have an accident, if you have epilepsy, whatever, you go to the doctor or the hospital, and the treatment is free. You might have to wait, and you can have private insurance for, nicer hospitals, better beds, whatever. But generally, we pay through our taxes, and it's free. I know in the US, it's quite different. I just wondered if you could talk a little bit about the US healthcare system.
Okay. Oh, you want me to? Okay, so what happens here? And I got to tell you, the reason why I'm doing this work, what happened was after I had the brain surgery, I did not want to go back into the garment industry. I used to work there. I worked there for over 10 years. It was very interesting. I worked for a lingerie company. But anyhow, I thought to myself, I'm not going back. All these big department stores were starting to close.
Yeah.
Clothing was not manufactured in the U.S. anymore. So I thought, okay, I have to find something different. So I stumbled upon, I was looking in the New York Times, and it said that they wanted customer service. Now, I didn't even know the name of the company. They didn't indicate what it was. But I was interviewed for customer service, and this woman says to me, "This is not for you. You're too experienced. You're too knowledgeable. I want you to go into claims." So I worked for one of the insurance companies, and and I was handling claims. And within 2 weeks of employment, they taught me how to deny claims. So, look, in the United States, you get insurance, and it's going to be the best thing going. And they have all these commercials on TV to purchase it. But people don't know what they're in for. Because what happens is, even though the insurance companies is making all these promises, look, they have to stay alive. And the worst thing, when I really started speaking around 2008, I spoke at, I don't know if anybody's ever heard of it, but it's called West Point, and they do training for the military at West Point. So I'm speaking there before about 200 people, and the first words out of my mouth was that the insurance company should not be on the stock exchange, because that is how they decide on whether they want us to live or die. And what goes on the insurance companies, and I've heard I hate to say this, but I've heard it even in England, that it depends upon your age, how they want to take care of you.
Yeah.
And I think that that is absolutely horrific, but that's what goes on in the US. It's starting to happen even more when they're looking at ages. So, they find reasons, they try to find reasons not to pay claims. And what we were talking about, before we started taping, is in these nursing homes here in the United States, you can purchase a policy that's going to pay part of their nursing home that you're in. I don't know if
Okay.
they sell, they do sell it. Okay. So it's called a long-term care policy here,
Mhm.
and you purchase it, and they've minimized it because they didn't realize how much money they're going to be losing on these type of policies. Okay. So you used to, like, I have a friend who had this great policy, he had it for years, and they would pay $12,000 a month lifetime. But now what they're doing is they're giving you like 3 years, 5 years, 6 years, and they have a certain amount that they'll pay out per month. And it's people try and hold back as long as they can, even if they can afford it, because it's getting more and more expensive.
Yeah.
They won't even insure me because I had epilepsy. So anyhow, that's pretty much what I'm seeing coming my way is the insurance companies don't want to pay out. They don't. They want to keep on giving their stockholders money, so
Yep.
their stockholders are happy. And so right now, what's going on is they're throwing the people out of the nursing homes if they have a Medicare Advantage plan, which is insured not by the government, but it's insured by the commercial insurer.
Mhm.
And the other thing that's going on is if you go through the emergency room, and the emergency room takes you to a room in the hospital. So the insurance companies, and sometimes I've seen cases even a week in the hospital, they're saying it wasn't medically necessary. We're not going to pay it.
So when you work for the insurance company and they taught you how to be overly rigorous with claims and to deny claims, when was it that you decided that, okay, this doesn't feel right? Somebody needs to be on the other side helping people through this complete maze of complications. When was it you decided to go to the other side to help people advocate for themselves?
Well, I'll tell you, I went from claims into underwriting. So
Okay.
that like pushed me out of the claims area. And then I had worked at one company for 2 years. I worked for another company for 10 years. And I'll never forget, within a month of employment at the first insurance company, they made me a supervisor of claims, and I had to take every irate phone call. So at night, I would come home and have a glass of wine because of the stress.
Yeah.
But the stress was so hard. So I had 2 years at one company, and then I worked for another company. I was there for 10 years, but the first 4 years I was in claims. And the stories I could tell you are unbelievable. But I knew at that point that how hard it was for people who are the insureds, and even how difficult it was for me to face this every single day. And at that point, I tried, to fight. But, look, you're hired by an insurance company that wants to be able to pay their employees and save money and satisfy their stockholders. So it was a crazy situation. I opened up a medical billing business. I adopted 2 children from Vietnam, and I took off some time, and then I opened up a medical billing business. But this was the clue of what I do now. The man who helped me open my business, they have an organization in the United States called SCORE. They might also be in Europe. But anyhow, he was in a restaurant that was supposed to be handicap accessible.
Mm-hmm.
He fell off his wheelchair. Twice he was in the hospital. Now he's going to court. And he's going to go to court to sue the restaurant that was supposed to be handicap accessible. So I looked at his bills, and I was able to figure out on the bills what was related to the injury, what was not related, and what was questionable. When we took that questionable and not related away, I reduced his bill from $108,000 down to $22,000. So when he won the case, and I don't even know how much was paid out, he only had to pay the $22,000 because of what I was able to figure out by looking at his bill. So that was my clue on what I can do to help other people. And, and I help people with all kinds of bills when they're denied, out of network, overcharged, they can't get pre-authorization. These long-term care policies that people have, the insurance company doesn't want to pay it out. And if they meet those requirements, I overturn those cases. Or if they were in a nursing home and now, a nursing home rehab, and now they're getting thrown out. If I can prove that they were improving during that time period, and even though I'm not an attorney, I go before Medicare judges. Medicare is the insurance for the seniors. And I usually get all the money back, or at least 2/3. And I get them to pay it out. So I love fighting for these people because I was on the other side denying.
Yeah.
And now I know how to fight. And it's a pleasure for me to be able to help people.
So this is a very generalized question, I guess. So sorry, but is it generally that the policies themselves are worded in such a way that they're hard to understand, or is it that the policies are very straightforward, but the insurance companies just deny claims?
Right. Well, they deny, and they deny because they need their money.
Yeah.
When I was at this second company I went to, I'll tell you this story. This was crazy. Somebody, they had a policy for disability, and it was a major corporation. This even international for this company. I'll never forget it. And it was a payable claim of $1 million. Okay. But what they did is they hold on to that claim for 2 years because they didn't want to pay out the $1 million. And then what happened is the day that after the 2 years went by, they sent a draft to the family and said, we're going to pay this claim, but you have to wait another month. So for them to let go of the money, it's like pulling teeth.
Yeah.
And you have to learn how to fight it. So what I gained by working at an insurance company, I gained how to fight. And the stories are just incredible, what I see happening. They're just like, and there are times that I can't sleep at night because I think about these cases, And that's why, like, even first what I did is after this gentleman gave me the clue, then I opened up, I had a medical billing business and I still bill for one provider, but I then opened up an advocacy business, knowing that with the knowledge that I have and experience, that I can help so many people out there. And then after that was going on for a while, my coach said to me, Adria, you've got to write a book. And that's why I wrote Solve Curing Your Medical Insurance Problems. Some of you might know who Ralph Nader is. He ran for president of the United States in 2000. He liked it so much, he won an international edition. It's multi-payer medicine nightmare made in the USA. But the last book that came out, Apparently Different, after I got those 2 books out, I thought to myself, okay, I was sick for many years. And when I got sick, I lost all my friends. They wanted nothing to do with me. And I thought to myself, okay, I need to write a book to tell people what happened to me and to have respect for those who have a condition. And right now I'm writing another book for children in 3rd grade. It's a mystery and it's very exciting and there's a lot of humor in it, but it's really for 3rd graders, but it's trying to teach young children in an early age to have respect for those who have a condition, not to treat them like you're scared of them or the fear or you don't want to be their friend, because of how sick I was. That's what happened to me. So I'm trying to make another change just to help others.
It's so important. I was saying before we hit record that my my mum died of Alzheimer's about 18 months ago, and she had it for, I don't know, depends when you count from, but I don't know, 3 years or so. And in the beginning with Alzheimer's, it can be, people can be a bit forgetful and they can be a bit repetitive, etc. But it really, and it certainly hurt my dad, and it really surprised me how many people that mum would have gone out to for a glass of wine or an afternoon tea or whatever just disappeared. People she'd known for years and years and years, and when not challenged on it, but when sort of asked about it, their thing was, well, I didn't know what to say, or I didn't know how to react, or I didn't know how to behave, and it was, yeah, it really surprised me how people just drifted away. Really, they came to the funeral, but you think, well, okay, that's great, but where were you for the last 2 or 3 years? No, I totally totally empathize with that, and I don't know whether that's just a human thing that we're uncomfortable around somebody that's not very well, or we fear that somehow we're going to catch Alzheimer's, or we're going to catch epilepsy, or we're going to catch cancer, or whatever. I don't know what conclusion did you come to when you thought, well, why are people not as they were before? What did you think?
I think it's fear. I think more than anything else, it's fear. And it's in certain ways, it's selfishness,
Hmm.
because let's say, look, your mom might not have remembered her friends.
Hmm.
Okay.
Yeah,
And, and, and maybe it was hard for her friends to come to see her because she was not the same person anymore, you
mm,
know, but I just feel at times that, let's say it was my child, and my child didn't want to see me anymore, because I couldn't communicate with them, and even a good friend. I mean, it bothers me because it's all about respect,
yeah,
and these people still have feelings, like even with someone with Alzheimer's, a lot of times they they still know who you are.
yeah,
Yeah. Even though they can't tell you, they know. But people don't understand that. I have to tell you, I think, there are times that when I look at myself and I see everything that I've lived through in my life, it, it, I hate to say this, but I feel honored that I was sick because I understand how other people feel. I wouldn't
yeah.
have known this if I wasn't so sick.
Do you do you still get a surprise sometimes when people come to you and say, we had this policy and we paid this money and we've been denied this? Do you still get surprised by some of the things that get denied, or do you think you've pretty much seen everything now?
When what surprises me more than anything is when it's something that should be covered
Hmm.
and they just don't want to pay and they find any reason to deny it. And I have to tell you what's going on right now. I've been blessed. I've been so blessed. Um, I have someone in the state of New Jersey who writes for me. He's a writer for a newspaper. And I'm trying to find as many writers as I can in every single state to help me. Because once that gets published,
Hmm.
very often they overturn the case. It's hard to get things published.
Yeah,
And they don't want bad things to be said about them. So like, you know what? Either do the right thing or this is what's going to happen. And sometimes it can be a threat that way. I have someone right now who's on the other side of the United States. I'm on the East. They're always all the way over on the West Coast. And I think I'm going to look for a writer because here's a situation where she had one of those Medicare Advantage plans and they were throwing her out within 2 weeks. She couldn't go home. She couldn't walk. And they billed her. She was in there for, I'm not sure what the period of time was. I'd have to look it up. But they billed her $68,000. And now that she hasn't paid it, they've increased with interest and fees up to almost $100,000. And what I did is I spoke to the hospital to try, because the hospital owns this rehab nursing home, and I'm trying to get them written off because she really can't afford this. She's never going to be able to pay it. She might only have 5 more years to live, and she's paying them $100 a month. And I'm thinking, hey, can we get one lump sum and leave her alone?
Yes.
I'm working on that, but it's hard. It's so hard and difficult. But, I'm hoping and praying that with my experience, we're going to come to an agreement. The interesting thing is it's a very small town,
Mm-hmm.
and it keeps on, all the employees keep on overturning. It's a very interesting case.
Mm.
Yeah.
One of the things we get here, and this isn't to defend the insurance companies, but if you go to a private hospital here to have something done, they will generally ask you, is this something you're going to be paying for with insurance, or are you going to be paying for it yourself?
Okay.
And you tend to find if you're paying for it yourself out of your cash, it isn't as expensive as it is if it's paid for by insurance. So the hospital will add on extra. I'm sure they'll justify it, which the insurance companies have to pay. And I didn't know whether you had that. And it's the same here. If you take a car into the garage to get fixed, and they say, "Is it insurance?" No, I'm paying for it. Okay, well, we won't do this, and we'll do that, and we won't do this piece, and we'll do that. Is that something you?
It's exactly the same. And
Okay.
I'll tell you, the first time that I really learned about this, I lecture before attorneys, financial planners, and CPAs about the industry.
Mm-hmm.
And I'm lecturing before this lawyer bar association. And this woman comes to me afterwards, and she says to me, and she's under 65. She said to me that she's never had health insurance because she negotiates every single bill. Okay. I was like, oh my God. and then she said to me, it gets even better. She says, when I turn 65, then I'll get the health insurance. The thing is this, if you are 65,
Mm-hmm.
and I've learned this, I would not purchase one of those Medicare Advantage plans. And people, what we were talking about earlier is when people think, oh, it's only going to cost me that much, and they say, I'm going to go for it.
Yeah.
That's when they make the mistake, because even though people pay more money to the government for Medicare, they're paying a higher amount. It's well worth it because you're covered for just about anything. If you take those Advantage plans or the commercial insurers, they're the ones who aren't paying because, again, they're on the stock exchange and they want to satisfy their stockholders.
It's like we said before about travel health insurance, isn't it? So if you buy the bronze level policy and you wonder, well, I'm not going to pay platinum. Why would I pay that much money? You get what you pay for.
That's
and
right.
That's the sadness, isn't it? If something looks too good to be true, guess what? It is. They're not going to be for anything. That's the big challenge. So one of the things you said before, and I wanted to ask you about this, was you said that these claims can keep you awake at night, and I can completely understand that. But how do you, if you do, manage to protect your own, mental well-being? How do you manage to sort of step away from thinking about this all the time? Can you do that?
It's hard, but I work out a lot.
Mm-hmm.
I walk, I do weights, I try and find something that's going to get my head off of that. I was so happy. I haven't taken a vacation in ages. I went away recently and I'm going away again, and that's helping me. Yeah. I haven't vacationed in many years, but I'm going to be coming to your airport.
Nice.
Yeah. But then I'm flying from there to Singapore. It's a gift from a friend.
Singapore. I was in Singapore about just under 2 years ago. It's a fabulous place. I wasn't sure what to expect, but take an umbrella.
I got to stop over in London.
Okay.
Yeah.
It gets so warm in Singapore, but then it always rains in the afternoon, like torrential for an hour, then it stops again. It's bright sunshine. But yeah, everything is spotlessly clean. Everybody follows all of the rules and regulations, and yeah, there's a lot to see there. Actually, botanical gardens beautiful. It's yes, they've done a good job. The government's really put a lot of money into it. I
You,
couldn't tell you about the healthcare, but
yeah,
the rest of it looks
you
pretty
gotta
nice.
you gotta try and free your mind from things, and
Yeah. Mm.
sometimes watching a movie,
Mhm.
reading, you know.
And
So,
that's one of the challenges I think that often, if somebody in the family is sick and somebody's trying to sort out their health insurance, it's very stressful for the person. They obviously want to spend time with the person that's sick and wants to put all their energy into that person, and they're having to try and understand when their claims have been denied, or their partner might be having to leave the hospital, or it's not going to get paid for, or ha-
and that in
what?
itself is a problem because a
Yes,
lot of times on the policies you have a limited amount time period to make a claim.
yeah, yes,
So that happens a lot where people come to me and they say, "Hey, I couldn't submit my claims on time. Can you help me?" Blah blah blah. And sometimes I'm able to, sometimes not. It's really, it depends how harsh or how
yeah,
much the insurance company wants to save, because they're going to deny it. They're going to say, "Hey, you didn't do it on time, so why should we pay it?" Even when you go through situations like that, sometimes you might have a kind heart, but not too often.
So, so if somebody has had an insurance claim be denied that they think is valid, what practical advice could you offer them?
Well, the first thing that I recommend people to do is call the doctor.
Hmm.
If your claim is being denied, sometimes there's so many different reasons why they're denied. And very often it could be the diagnosis. Like, for instance, here in the United States, you can get free services, like for a woman for a mammogram. I don't know about men with prostate; they might be able
Hmm.
to. But there are certain free exams that you have. Now, what happens sometimes? You go to the doctor, you have the mammo or some other type of thing that like your physical. But what they do is they don't. We have codes. We have codes here. You have the same codes in
Yes, we do. Yeah, yeah.
yeah. And those codes are your diagnosis. So it depends upon what the diagnosis code is. And if that code is not correct, then they're going to go ahead and deny it, or bill you, because like these services, a lot of policies, it's supposed to be for free, where you go for the annual. And then when you have the procedure done, what happens is you're going to get this bill. Well, why am I getting billed for this where it should be paid? Like I have to go for a test soon. And I said to the company, they've been bought out by this large corporation. I've had issues myself, and I'll fight them. I don't care. Maybe that code has to be changed. I've got a case right now that's been dragging on for 6 months because they've used a wrong code. They don't like me bugging them. Make the changes. You want to get paid? Make the changes, resubmit it, and let's get it paid.
Yeah.
Yeah. So that's just an example, you know. But the first thing you really need to do is go talk to the doctor. Then the next thing that I recommend is talk to your insurance carrier. Find out why they're denying and ask them. They might not give you the right answer. A lot of times everything is very secretive. When you call them and ask them questions, but try and figure out. And it's usually when they deny a claim, it's usually on their letter what you can do to
Hmm.
appeal it. Okay. So then you go through the appeals. You try and get help from your doctors, because your doctor, a lot of times they're going to say, like, for instance, it wasn't medically necessary. Okay. So you have to get that doctor to write a letter explaining why it was medically necessary. And if you didn't do this, what could happen to you? And I usually use that for a reasoning.
Mm.
So then you do the appeals. And when you do the appeals, the if you go to the state Department of Insurance, Attorney General, or Consumer Affairs, they really want you to take all the steps that are required by the insurance company. So once you go through all those steps, and if they keep on denying you, then again you can go to the Department of Insurance for the state that you're in, the Attorney General, or some states they have Consumer Affairs situations. Then My feeling is if you're still at a point that they're still denying and you feel that they've done the wrong thing, if you can, you could go to your Congress people who are your elected officials and or the media. The media is very hard, but it's just another avenue to help you.
So, in something we don't have in the UK in the same way in the US is the lobbying culture.
Uh-huh.
So, I'm guessing that a lot of the big insurance companies help fund some of the campaigns that politicians run. So it's very hard, isn't it, when you've been funded by somebody to say, well, yeah, Is that something that happens that they spend money on lobbying?
They do. They do. And in fact, there are times when I want to reach out to a politician and even trying to get to the media is hard because of all the advertising from the commercial
Yeah, cool.
insurers.
Yeah.
Oh yeah,
Yeah.
yeah, it's hard. So even with the Congress people, it's like who have funded them,
Yeah.
and you can find that out.
Yeah, which
Yeah,
is
yeah,
quite good. Yeah.
yeah.
It's interesting. Before you talked about being in the garment industry, so I was a resale buyer for a big department store for a while,
Wow.
and one of the things that we had to watch out for in particular was we would try to hold off paying suppliers for as long as possible, looking for if the supplier had happened to put down a slash instead of a hyphen in the purchase order number, or has somehow got the quantity wrong on the purchase order, or did something wrong. No, we can't pay that. The invoice doesn't match, and it was terrible. But then and we'd always have a 2.5% discount for 30-day payment, which we'd
Okay.
always take, whether we paid you in 60 or 90 days. So
Right.
being a supplier must suck. It really must, because we've got the product, we've probably sold it, and we are holding out, trying not to pay it. So it's not just medical insurance, not quite in the same way.
It's
But
tough
anyway,
to run a business that way.
yeah, it is.
Yeah.
For manufacturers, when they have to buying the product, buying the materials, buy everything in, they've spent the money already, and then it's out of their door, and it's very the cash flow must be so hard for the small manufacturer. We should do another podcast on
I'm
the
even
garment
right now
industry.
when you said that, I'm thinking about the tariffs.
Oh gosh, yes. I just it just bewilders me. I was going to ask about that. So one of the things that the new administration's talked about quite a bit is Medicare and Medicaid, and with a new health department. Do you think there'll be big changes coming? Or do you think they'll be positive or negative?
I'll
Or
tell you what my fear is. I have a big fear, even for myself.
Mhm.
Okay. Like I said to you, I pay extra money for the Medicare.
Yeah,
But what if our government was saying, no, 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 it has to be all run? The government might not want to take care of it anymore.
yeah,
So what happens if all the commercial insurers are going to run everything and everybody gets thrown out of the rehab within 2 to 4 weeks? I mean, this is my fear. I don't
yeah,
want to be in that position. I want to be taken care of the right way.
yeah. That is a very legitimate fear. I think we just feel that the government and many governments around the world they're sort of trying to outsource everything. No, we don't want to do that anymore. We'll pay a commercial company to do it. But as you said right from the beginning, the whole thing with is the clues in the name, commercial, for profit, and that's what it is, isn't it? So if you've got, and they all do have demands from stockholders and shareholders and from private equity or whatever else, their role is to make money, and
Right.
that contradicts
Right.
healthcare, and that's not how it should work. But yeah, let's hope it's not quite as bad. So what does the future hold for you? When will the new book be out?
The new book is it's really for children. I
Mhm.
want them to learn early to be kind to others, to have respect for others, um, and not to be scared. It's the book is got about around 31 chapters, and I thought to myself, okay, it's for children. We need artwork. So what I have done, and I'm really working very hard at this. And I'm happy you brought this up because anybody who's listening to this, if you know somebody who has a disability and wants to do artwork for the book, call me. That's what I'm looking for, because
Fabulous.
I knew how tough it was to have a disability. And this really is trying to change the attitude of children to learn early, to be respectful. But I thought to myself, okay, if I can get artists out there who have a disability and will have their artwork in the book with their name, I feel it's a blessing to them. And that's what I'm looking for. And right now I do have some art pieces, but I'm out there searching. Like I was hoping, because of the holidays, one of the schools I want to reach out to, it's a high school, and they have an art class for all the students who are part of this program who have autism. So I am hoping and praying that they come back to me and work with me to get artwork from these students, because it's, I really don't make money on my books. I do it for pleasure to educate, and it's very hard to ever make money on books. But I thought to myself, if I can get artwork from these children who have a disability and have their artwork in the book and their name, I really feel that that's an honor to them. So right now I'm looking for that. And it's going to be exciting, because when you start reading the book, when you get into the first few chapters, you learn that all the children who are at this school, the thing is, where is the artwork? Who stole the artwork? We can't find it. So, and we do find, as the story goes on towards the end of the book, who the person was who stole the art, the material to do the art. Okay. The paints and the brushes and all that. But the thing is that the students who are in the book all have a disability. So I'm really excited about it, because I know what happened to me, and I just hope and pray, for people, that there is a change on how others treat them. It's more important than anything else to me.
It is. Like, it's really, yeah. Yeah.
I mean,
No,
even if there was ever a movie, like people recommended a movie because of how unusual my life has been. When I first got sick, it went 180 degrees in one direction, and I lived there for 25 years of my life, and then it went the other 180 degrees back to normal. But as I said before, I mean, I feel honored that I was sick to try and educate others on doing the right thing.
it's impossible to think what your life would have been like if you hadn't had that horse riding lesson. And what would have happened? Would you have been a corporate lawyer, or would you have been what? Yeah, it's hard to know, isn't it? I guess. But yeah, life leads you in the right direction, whether you want it to or not. Really, sometimes. So, would you say that you're? That's a silly question, but would you say you're happy now?
I'm happy now that I was sick. It was a very tough life.
Yeah.
I mean, like, oh my God. One time I fell on the subway tracks in New York City,
Oh gosh.
and someone pulled me up. I mean, there were certain times in my life that I feel that there was somebody watching over me all the time, and people were helping me, and maybe even from that, I learned a lot, because here I was sick, and these people, helped me. So listen, when you don't go through certain experiences, you don't learn,
No.
So I feel that in this life, I've learned so much, and I'm so grateful.
Well, thank you so much for sharing your story. It was fascinating. I'll put lots of links into the notes. I'll reach out to some people that I know that have autism, but that do art as well. So
Oh
I'll
my,
pass those
that would
names
be,
on to you.
I'm so happy we talked about it.
Yeah, it's a fascinating topic. So no, really, really good. So yeah, well, enjoy your travels via London. Enjoy Singapore.
Thank you.
Yeah, and thank you so much.
Oh, thank you.